Hello, we are the Association for Child and Adolescent Mental Health, or ACAMH for short.
Hopefully I'm showing my screen, is that right?
Yeah, all good.
We're sharing the slides.
Sharing this, so we can see the slides and we can see the slides coming on the next bit.
Okay, we haven't got that much in the way of slides, but just to sort of just have some visual structure. So anyway, the pleasure's all ours. Thank you so much for inviting us to celebrate World Autism Awareness Week with this webinar with you. So we're really pleased to have this opportunity to talk about how our understanding of autism has changed in recent years, and how certain perceptions of autism have changed or are changing or need to change. So fundamentally, many of these changes stem from the fact that our understanding of autism has widened from a narrow medicalized disorder type of model to a far broader understanding of the spectrum, and how some features of autism can both be assets and or challenges depending on the context. So today we're going to talk about some of those perceptions or myths that are now being challenged by better understanding. And the first one I'm going to start with is that myth number one. Hang on, so I'm not going to be brilliant at managing the slides at the same time. Hang on, I've now lost the slides. Can I just keep talking anyway? So the myth number one is that people with autism aren't sociable. That's all that is on the slide, on the first slide. So we can always share slides later. I'm so sorry, I don't seem to be able to find them. And in fact, many people with autism have got strong social connections, often with like-minded individuals or through common interests, much like non-autistic people. In fact, it might be true to say that people with autism do experience difficulties, of course, socially, and many are more isolated than they would like. And some autistic people do report genuinely preferring to avoid social situations, maybe because they find socializing confusing or uninteresting or exhausting at times. But the recent lockdowns gave us an opportunity to think about the impact of some of the enforced social restrictions on autistic people, as well as everybody really. And several studies looked at this and found quite mixed findings. So, for example, some research by Liz Pellicano and colleagues indicated that autistic people were just as impacted by the lack of socialization as were people without autism. So they talked about the impact on their mental health, missing not only existing social connections, but also incidental social opportunities also. So to be fair, the research is quite mixed. And in fact, the impact of lockdown on people was mixed as well. So in some ways, the reduced social opportunities also reduced social pressure and reduced anxiety levels. But equally, many people with autism felt that lack of social contact just as keenly as non-autistic people. I also came across an interesting article today about the connectedness that autistic people can feel with each other. I often work with young people who have friends who also have neurodiverse traits. And I think, like any of us, people tend to gravitate towards other people who get us. So in short, autistic people do seek social relationships, but there may be a number of factors that make socializing challenging. So being around people who understand, or in environments where differences are understood and supported, can really, really help with this. So helping people to develop their social skills through formal social skills teaching might be one strategy, or making sure that teaching staff or work colleagues are aware of differences is another strategy. So for example, knowing that if somebody's communication style seems to upset people, that most likely it's not intended to be rude or confrontational, but maybe stems from a tendency towards a more direct style of communication, for example. And it's also important to recognise that socialising with all the demands, for example, processing language, understanding other people's intentions, reading the room, can be really exhausting, and that a quiet place or downtime might be needed at home, at school, or in the workplace. So that's my first myth. So over to Mariana for myth 2, and I'll try and work out where the slides have gone.
Oh, just need to unmute Mariana.
Thank you, that would help. Thank you. Thank you. Thank you so much, Anne, for this introduction. And myth number two is one that actually for a long time it was assumed that people with autism find it difficult to understand what other people are thinking or feeling. And it was assumed that this made it more difficult for neurodivergent people to fit in, make friends, or indeed express empathy. Well, let us start dispelling this myth by a quote from Donna Williams, who is a multi-talented Australian writer and artist who wrote several books about her experiences of being autistic. Donna said, right from the start, from the time someone came up with the word autism, the condition has been judged from the outside by its appearances and not from the inside, according to how it's experienced. As such, what is observed on the outside tends to be interpreted by a kind of neurotypical lens. And as we are increasingly able to learn from the perspectives of neurodiverse communities, there is an increased understanding that different communication styles can result in communication mismatch. More recently, studies have shown that the problem is actually bidirectional, and that people who do not have autism find it just as difficult to understand what people with autism are thinking or feeling. So this is often referred to as double empathy problem, which is a term coined by Dr. Damien Milton, who is an autism activist, lecturer, and sociologist. The concept of double empathy implies that differences in communication styles and social expectations can lead to communication breakdowns, which can be a source of distress for both people with autism as well as people without autism. However, rather than it being a problem only on the side of neurodivergent people, it clearly is a problem which goes both ways. Hopefully, having this understanding will encourage us to have more open dialogues about different ways in which we communicate and hopefully increase mutual respect and understanding. Myth number 3, Anne, and we lost our slides.
Yes, I'm afraid to say I just can't quite find them, but myth number 3, and my dog's now having a little moment, but anyway, is that people with autism have no imagination. Autistic people have no imagination. So this one, I think, has probably been busted for quite a while now. So I think it's well recognised now that many autistic people have got fantastic creative abilities. I've certainly worked with clients who have written beautiful poetry or who produce artwork, which is not only creative, but incredibly expressive. In fact, it may be that many autistic people find it easier to express themselves emotionally through imagination and creativity rather than via direct communication sometimes. I think it's true to say that the play of autistic children can be more repetitive and maybe less imaginative than their typically developing peers sometimes, but this isn't true for everybody. And also a preference towards repetitive or mechanistic play doesn't necessarily preclude the development of wonderful imaginative skills. So sometimes harnessing or fostering creative skills needs an understanding of autistic differences. So, for example, somebody might be a talented artist, but they might find it difficult to conform to the expectations of art GCSE, for example. So helping people discover their talents or facilitating creative skills to flourish can be a really important aspect, I suppose, of identity development and also developing people's self-esteem as well. And a related myth, which I would like to bust as a practicing clinical psychologist, is that metaphor should be avoided when delivering therapy for autistic people. I think metaphor can be a really powerful way of illustrating a point or helping people to look at something differently. I think the assumption might be that autistic people won't have the imaginative skills or flexibility to think in the abstract, but I've certainly experienced many autistic clients who not only understood metaphor, but also brought their own very creative and relevant metaphors to therapy, which we were able to run with and use. So over to you, Mariana, for myth number 4.
Thank you, Anne. So myth number 4, people with autism have difficulties with communication. This myth is very deeply ingrained in people's minds to the point that it's included in majority of textbooks or professional presentations about autism. Some of that likely stems from our historical view of autism, or in fact, any kind of diversity, where any kind of diversity was viewed as pathology. But we could also question to which extent this myth is really perpetuated by the lack of reflection of neurotypical people. if we define people with autism as having difficulties with communication, we are kind of implicitly implying that neurotypical people have a better or superior communication. But is that really the case? People with neurodiversity often prefer communication which is clear, precise, correct, honest, direct, to the point. Communication which is about topics that clearly matter rather than small talk. I mean, I personally know a lot of people who complain about small talks, but we still feel that it has to be done. So neurotypical communication style can, on the contrary, be much more kind of multi-channel and actually confusing. For instance, where our communicative partner says, that's interesting, what I actually mean or usually mean is, okay, that's enough about this. Or often we may say to a child with autism, that's funny, when they make a joke, which we actually feel may not be quite well integrated in a context. And then we say that the child has difficulties with understanding appropriate social context when they repeat the same joke again. Having been fortunate to be surrounded by a neurodivergent community, I have endless anecdotes about how excellent, in speech marks obviously, communication skills of neurotypical people are. To mention just one, a wonderful colleague and a friend of mine who has autism very kindly offered to help me with my website. And helpfully, he asked me what I would like it to look. And I was trying to be my most grateful, appreciative, kind, accommodating self. So I said, absolutely anything. I would like anything at all. And of course, next day he sends me a link for me to check out what he designed. I opened the link and the website is literally one color, which I do not like. Okay, so I apologized to him and I said, I'm really sorry. This is literally one color I do not like. There he is. He doesn't mention to me, Mariana, I asked you. He politely asked me which color he can change it to. So next day he changes it to my color that I like. And have I learned from my previous mistake? Absolutely not. So when I open the link, it is the color I like, but it's really hard geometric kind of masculine shapes. So there I am having to apologize yet again for not actually saying what I wanted. I will spare you from continuation of this story, but I can assure you that certainly I actually, had I only listened to the question that he asked me and answered it clearly, we could have prevented a lot of problems. So have I adapted my communication style? Clearly not. So if we as neurotypical people want to claim that people with autism have difficulties with adapting their communication style, we ought to question ourselves whether actually neurotypical people are adapting their communication style to suit neurodivergent community. And if people truly reflect on their communication styles, neurotypical people who claim to have less difficulties with communication and less difficulties with flexibility seem to have just as much difficulty adapting their communication style that neurodivergent members of our community. As such, are there differences in communication styles? Yes, there are. But equally, there are times where different communication styles are preferable. For example, if someone is operating on my eye, I would much rather prefer them to have direct, clear communication style than hinting on something or saying something they do not mean just to be kind, again in speech marks. As a result, our take-home message ought to be to learn to recognize and appreciate strengths as well as weaknesses of diverse communication styles, depending on the context and situation. The main message we would therefore hope to raise is one of open communication to increase mutual understanding and appreciation. See you for next myth.
Okay, so myth number 5 was that autistic people are bound to be anxious, part of autism. So again, this one's been busted for quite a while now. Recently, there's been quite a bit of attention given to the fact that autism is still classified as a mental disorder, and we're of the view that the very use of the word disorder does imply that there's something wrong with having autism. So while we're not advocating a view that autism does not confer challenges, we feel that thinking of autism as a disorder overly pathologizes people, so we much prefer to think of it in terms of neurodiversity. However, we do recognize that one of the most common associated challenges with autism, which is that of emotional difficulties, sometimes was very overlooked until relatively recently. So the high levels of anxiety that many people with autism experience, or rather the fact that anxiety is a separate treatable condition, has often been neglected. So it can still be very hard for autistic people to access the right support with mental health difficulties, including anxiety, particularly at the moment. But at least now our understanding of how anxiety presents and how treatment might need to be adapted is a little bit more sophisticated. So in terms of how to manage anxiety, well, quite a lot has been written about adaptations to therapy, and medication has a role to play as well, of course. But we believe that the best anxiety management strategy is environmental adaptations. So for example, having advanced planning, preparation, having space to go to at times of overload, visual supports, to name a few. Those sorts of things might happen in schools. We're going to talk a little bit more about adaptations in a bit as well. So over to Mariana for myth number 6. Oh no, it's me, sorry, myth number 6. Myth number 6 is that all autistic people have a special skill. So some people with autism do have phenomenal skills, like being able to calculate what day of the week a date was, or recreate images that they've seen with incredible accuracy to detail. And some of these special talents might arise from particular cognitive profiles, which are sometimes associated with autism. For example, strengths on tasks which require visual processing and a detailed focused approach, for example. And research does suggest that about a third of autistic people may have a particular special skill. But for the most part, autistic people have strengths and difficulties much like anyone else. So again, going back to the point about fostering imaginative and creative skills, it's about helping people identify their strengths, and equally importantly, finding things that they enjoy. So some special skills can lead to successful careers, and it's encouraging to hear about many firms offering neurodiversity recruitment initiatives, for example, as well as adjustments within the workplace. So the civil service, for example, has a system called workplace adjustment passports. Again, we're moving forwards, I hope, in busting that myth. So over to Mariana.
Great. Myth number 7 is it's kind of myth that we understand now autism better. So it's true to say that our understanding of neurodiversity and autism spectrum has evolved significantly over the years, and our diagnostic criteria are also more clearly defined, which has led to improved recognition. However, in truth, it's fair to say that autism spectrum defies any stereotyping or generalization of any kind. And in fact, we are seeing great heterogeneity on the autism spectrum. Whilst there are commonalities among people with autism that form defining diagnostic criteria, the way each feature presents varies significantly. So if we consider any feature, which is one of the main diagnostic features for autism spectrum, such as, for example, sensory differences. Yeah. Oops. Oh, thank you.
Thank you. Got me back.
No, great. So if you consider actually any feature that's kind of any defining diagnostic criteria, we see huge heterogeneity in how it presents. So for example, let's take sensory differences. We know that some people with autism spectrum might be experiencing such significant sensory hypersensitivity that even seams on a clothing or clothes labels can be source of significant distress, whilst other people might be experiencing such significant sensory hyposensitivity, especially in response to kind of the internal stimuli, that they perhaps might neglect, let's say, basic kind of needs, for example, response to hunger or thirst, etc. Similarly, if we consider qualitative differences in social interaction, we can meet people on the autism spectrum who generally have preference for solitary activities to people who are hugely socially motivated. And the same can be said about every diagnostic feature associated with autism spectrum. For example, qualitative differences in communication. Some people with autism spectrum develop the most rich vocabulary I have ever come across. And in fact, English not being my mother tongue, I'm very grateful for really unique learning opportunity to learn very special and rare words from children with autism spectrum I work with. Whilst other people do not find verbal communication satisfying or may not use verbal communication at all and may prefer to communicate via pictures or other behaviors. So one of the biggest myths about autism is that we now understand autism, because autism spectrum, as we said, defies generalization or stereotyping of any kind. And we are seeing greater heterogeneity on the autism spectrum than in a general population. As Dr. Stephen Shore, who is an autism advocate and a member of autistic community, once famously said, if you've met one person with autism, you have met one person with autism. And this is very important for us to be aware of, because even if we make an effort to educate ourselves about autism, as many professionals or teachers make genuinely attempt to do nowadays, the same strategies were highly effective for some children on the spectrum may not be helpful for others at all. As a result, what we ought to be working towards is openness to learning from our neurodivergent community through continuous dialogue and consultation, as well as encouraging self-advocacy in our children and people with autism since young age in order to make sure that we create much more inclusive environments than we have currently. And this kind of leads to our last closing point or a myth, and that is that severity of autism or the amount of support impacts on outcomes in adulthood. So one of the first questions that majority of the parents ask after diagnostic assessment of their child is, how severe is my child's autism? And second question that very often follows is, what therapies and supports should parents put in place to help children overcome their difficulties? Whilst both of these questions can be understandable, and whilst in the past, severity of autism was indeed considered to be a predictor of outcomes in adulthood, studies over the past decade did not confirm this at all, and research does not seem to indicate that severity of autism is a good predictor of outcomes in adulthood. By outcomes in adulthood, we mean things that impact on the quality of life, like, for example, access to leisure activities, friendships, independent living, marital status, self-realization, employment, etc. And actually, other issues, for example, daily living skills or adaptive functioning or having functional communication, as well as sound mental health, being actually just as important, if not more important, predictors of adult outcomes, especially when we are thinking about all these measures of quality of life, as we mentioned. So there is now really no doubt that people with autism or neurodiversity in general contributed significantly to all walks of life, from science to arts and technology. And we would therefore like to conclude with a very clear message that autism should never be in a way of people achieving well in life. And in fact, there's increasing number of parents who self-refer for assessment after their children have been diagnosed, who are wonderful role models for their children and in general, in terms of being neurodivergent and having fulfilling careers and personal lives. And clinically, I've been fortunate to work with people with neurodiversity for over 20 years. We have seen children with diagnosis to flourish in so many ways. Actually, we're really delighted to see that increasingly many young people with neurodiversity are now deciding to study psychology at university, as we would very much like to encourage neurodiversity in a profession as well. But indeed, there are now increasing voices from the autistic community, clearly demonstrating the amount of talent and ambition in neurodivergent communities. However, unfortunately, research does still indicate that people with neurodiversity are at increased risk of developing mental health problems and of underachieving both academically and in terms of employment. So whilst it is helpful and important to focus on therapeutic support, in our closing remark, we would like to emphasize our responsibility as being parents or professionals or colleagues, friends, or members of community to make our society much more open to neurodiversity in order to enable people with neurodiversity to thrive and achieve to their potential. So that was kind of our prepared thoughts on a commonly, asked about myths on autism spectrum. Do we have any questions?
Yeah, that's brilliant. Thanks very much. I'm just going to launch a poll now that people can choose to fill in if they want about the talk. So Anna Mariana, we had something about a question around different presentations in girls, and I was wondering if you could talk a little bit about
that. Yes, do you want to start, Mariana, or shall I? I don't mind.
Yes, I mean, I'm very happy to either way. We actually have, as you know, separate webinar on presentation in girls. And indeed, there's a myth about girls as well. So for once, autism was assumed to be a lot less prevalent amongst girls and females in general. However, we now know that actually this can be very much accounted for by our tools that we have for diagnosis, perhaps not picking up on a female presentations as well as on a male presentations. And we know that female presentation of autism spectrum was actually very often attributed to, for example, or was not even picked up until many girls started presenting with co-occurring mental health problems such as anxiety, depression, or externalizing problems. And another myth, since actually the awareness of female presentation with autism spectrum has been kind of become much more in the forefront of public awareness, has been about girls and masking. And whilst it is absolutely true, you know, masking camouflaging is a significant issue in this population. Actually, research is showing us that actually we see, say, masking, camouflaging amongst boys and males kind of with autism spectrum as well. But what we are learning is that for some reason, it seems to have slightly less of an impact. Few studies are showing there's not really conclusive findings in that in terms of the impact on mental health that it has for females and males. Did you want to add anything, Anne?
I think that's very comprehensive.
That's brilliant. Thank you very much. Just to let everyone know that the session is being recorded. It'll be up online tomorrow, and we'll also be sharing the slides there. So we've had a couple of questions around anxiety and what appears to be severe anxiety with people not wanting to attend school or leave their bedrooms and coming out in kind of rashes and hives. Is there anything, any strategies that you could recommend for this at all?
I think so. One of the keys is recognizing as early as possible, first of all, diagnosis, and then secondly, what can be done about the environment to prevent anxiety getting to the point where somebody is really struggling to attend school at all. Because then they're not going to be able to reach their potential. There's all sorts of opportunities which aren't going to be available to them. So it's really about understanding as early as possible and then management via the environment. And as I say, sometimes small things, what might appear to be a small thing anyway, can make a massive difference and can be the difference between someone attending school or not attending school. So for some young people that I've worked with, it's literally dropping one subject. Maybe it's a particular subject that they just didn't get on with, and then at least they had the break in the day. Sometimes it's about having a relationship with trusted people. Sometimes it's about having space or downtime. Sometimes it's about the support that's brought within the EHCP, Educational Healthcare Plan. And sometimes it's about changing the environment altogether. So that's thinking about it with young people. Obviously, the more that education and health can collaborate and work together, the better. You know, this is one of my particular favourite topics. I think most people know that about me, which is the impact of education on mental health. So rather than treating necessarily mental health, sometimes it's actually, you know, won't even start to treat the mental health problems until the environment's sorted out. So, yeah.
Brilliant. There's quite a few questions around comorbidity where other mental health issues might have an impact. Is this more prevalent? So, for example, we have people asking about ADHD and also OCD.
ADHD certainly, and this is where the neurodiversity concept comes in, becomes very useful. So rather than thinking about people who have either autism or ADHD, or both autism and ADHD, you can of course have both conditions, but we often talk about the Venn diagram when we're sort of presenting our formulations to clients, which is thinking about how the conditions overlap. And then kind of sometimes unpicking like what's the driver here. So for example, if the presenting feature might be inattention, then we'd be wanting to think about, well, is that because of autism, because maybe somebody's focused on their own thoughts, or it's difficult for them to disengage with their own thoughts, or is it because of a fundamental difficulty with concentrating and fundamental sort of intrinsic attentional skills? That's one example. OCD, certainly, again, there's an overlap there with the sort of repetitive, what's called the sort of repetitive restrictive behaviours kind of domain, as it were. But again, there's that sort of overlap between repetitive behaviours and repetitive thinking, I suppose, that one might see in OCD as well. And then, of course, anxiety is a very, very common co-occurring condition. And sort of 40 to 50% of people will have clinically significant anxiety levels. So not just a bit of anxiety, but clinically significant at some point in their lives. And as we know more about depression as well, so depression is much more prevalent. Again, possibly sort of around 40 to 50% of people will experience features of depression. I hope that answers the question.
We've got a question here around meltdowns. So if you could briefly explain what a meltdown is, and also if there are any specific strategies to alleviate this.
Great. So again, actually, it might be helpful to put a link to the webinar, because we have done in the past one webinar fully dedicated to meltdowns. And I think the key in understanding meltdowns is actually trying to differentiate and understand that actually behavior is a form of communication. So if you kind of underlining premise, if you take the behavior as a sort of communication, and what is the child trying to communicate? So the key factor is really trying to differentiate perhaps what might be the difference between a tantrum, where the child might actually want to have some particular, for example, tangible outcome from their behavior, to meltdown, which actually can be kind of as a result of a total sensory overwhelm, for example, or a kind of multi-system kind of shutdown. And really trying to understand the difference between different forms of communication, difference between tantrums and meltdowns, and most importantly, trying to understand what the triggers are that can increase the risk or likelihood or lead to meltdowns. So when we are thinking about meltdowns, we're always thinking kind of prevention being number one, really, strategy. We're really trying to avoid and prevent meltdowns as much as possible and reduce any triggers that could lead to meltdowns. Secondly, is kind of learning the signs when perhaps child might be becoming kind of reaching the kind of increased, sense of overwhelm. So perhaps trying to withdraw the child from the environments that are causing that, kind of whilst the meltdown can still be prevented. And then lastly, kind of when the meltdown is happening, what it is that works the best for the child in terms of actually just calming all of the senses, providing calming, safe environment, reducing the stimulation, including our own stimulation of perhaps panic, distress, etc., reducing our nonverbals, kind of providing much more soothing and peaceful environment, ensuring child safety. And then maybe once when a child is much calmer and ready and able to talk, is thinking collaboratively with the child about what kind of triggered that and how can that be prevented in the future. But we have much more details in our webinar.
That's brilliant. Thank you very much.
Resources and links as well.
Excellent. Is there evidence to show that neurodiverse people are drawn to each other in any way?
Well, there was that paper that I mentioned. I literally just saw it today, which suggested that, yes, there's a lot of benefit that can be derived from within the autistic community, from forming connections with each other. So yes, indeed.
And what I would strongly actually say that what people with autism very, very often recommend, that one of the most important factor for both their emotional well-being and for kind of succeed, whether kind of in employment or anywhere else, was actually finding their own tribe, which was actually frequently reflected, referred to as. But it was not that the tribe was not necessarily always reflecting neurodiverse community. It could have, but also kind of shared interests. So shared interests are also one of the main common driving factors, as well as mutual understanding.
Excellent. We've got a question here. To what extent is eye gazing in pre-verbal development affecting a child with communication development?
Sorry, Matt, I'm not sure I fully understood the question. Would you mind repeating it?
So, yeah, in relation to communication and child development, to what extent is eye gazing a pre-verbal development of this?
Pre-verbal, you mean in terms of developing communication?
Yes.
Oh, absolutely. Yes, great. Thank you so much. So, I mean, there's been huge amount of studies done on eye contact and differences in eye contact in social communication. But of course, eye contact is, we can see from the earliest development, you know, where eye contact is one of the first kind of communicative form between infant and parent. I could see from the introductions that we actually have some people for whom infant observation is a subject of their study or profession who are present here today, who will be able to answer it much more adequately. But of course, eye contact underpins really many things, as you can see from earliest ages, kind of mimicking of facial expressions, developing, for example, you know, checking in with adult what is safe. Shared attention has been quite, or joint attention, there's been quite a lot of research even on the impact of kind of joint attention on not just development of pre-verbal communication, but actually even verbal communication, you know. So for example, you might be holding a phone in your hand and you would be looking at a teddy bear on a table and you would say to the child, yes, that's right, darling, that's a teddy. But the child is seeing you to hold a phone. So how do they know what is a teddy? Is this a, so actually eye contact does underpin a lot of crucial rudimentary building blocks for development of both verbal and non-verbal forms of communication.
So we've got a question here about PDA. So I think first, if we could just explain what PDA is and does it have to present at school and home?
So PDA stands for pathological demand avoidance, which has proved quite a controversial term. People use different terms as well, extreme demand avoidance or demand avoidance presentations. And it kind of refers to the avoidance of demands, but not just because people can't cope or they don't have the skills or they find them aversive. But fundamentally, there's something about a lack of control and anxiety around conforming to expectations and demands. So it can be very challenging to manage, and one of the reasons, so it's kind of considered to be part of the autism profile, but one of the reasons that people do advocate for having a separate concept for PDA or whatever you want to call it, is that the traditional techniques for managing autistic type of behaviours or meltdowns might not be effective. So they're quite a different set of strategies. Was there a second part to that question? Sorry.
About school attendance, basically.
And it was about whether it has to be across both settings.
Yes.
I mean, it's not a diagnostic category as such, so there aren't formal criteria. Certainly in our experience, no. Actually, some people can present wonderfully at school, but the challenges are at home in terms of the demand avoidance. And this can be to do again with anxiety about not wanting to stand out, about breaking rules, getting into trouble, etc. But that can result in the pressure of conforming and adhering to demands at school can be so enormous that children then come out of school and have emotional challenges at home.
Excellent. We have a question here relating to selective mutism. Could you first of all kind of briefly explain that, if there are any strategies to help with that, and whether it affects a particular age group at all?
So selective mutism, although like with quite few other co-occurring conditions, they can be two separate conditions. So selective mutism can be associated with autism spectrum, and it doesn't necessarily need to be associated with autism spectrum. So perhaps really kind of good understanding of kind of what is underpinning the development of the condition. Is it selective mutism, or is it actually autism? Is it based on a basis of neurodiversity? And then really there are very clear evidence-based protocols and kind of strategies to really encourage the child's kind of reduced anxiety, increased kind of social focus on social interactions, reducing the importance of language, and actually making the social interaction enjoyable for the child, increasing the child's kind of desire to engage in social situations with reduced pressure, and even reduced pressure on language. So perhaps kind of thinking about the anxiety triggers and general social pressures on a child in general in various environments.
That's brilliant. So we've got time for one last question, and it's probably the toughest, really. So when parents are waiting for a diagnosis for their children, what should they do? What can be done?
Yes, it is very, it is very, very tough. And it is actually particularly tough when kind of now post-pandemic, because, before we considered that to be a major problem, that many trusts had, let's say, 1 year waiting list, but this actually has now been increased to really 2 or even 3 years in some of the trusts. So, in child development, this is an incredible amount of time. And I suppose, what we always try and kind of focus on is utility of a clinical diagnosis. Yeah. So whilst obviously having diagnosis is important in order to inform supports and services, and for many young people also in terms of their identity, but actually a lot of strategies that we recommend, especially, for example, in education or in terms of adaptations, for example, psychological therapies, etc. Actually, many of those are just kind of good practice guidelines that many other children can benefit from. So actually, if you're thinking about adapting environments at school, many of the strategies we would be recommending would be just as useful for children, for example, with more severe anxiety, ADHD, language difficulties, things like, for example, visual resources, room for timeout, opportunity for kind of one-to-one support when needed, etc. So it's always thinking, whilst people are waiting, can actually this child, can we maybe just have open kind of working hypotheses that a child would need his support, and can we adapt a more child-centered approach rather than necessarily diagnosis kind of driven approach? That would perhaps be, our recommended way forward, is kind of thinking about a child-centered approach.
Find out more about becoming an ACAMH member and to be part of the advancement of child and adolescent mental health. Visit www.acamh.org.